Welcome. Lyon County, Northern Nevada, beautiful day here. Health worker, OB. Good afternoon. Hi, everybody. Thank you so much for joining. I want to be cognizant of everybody's time, so I'm going to go ahead and get started and let people join. If you're just joining us today, I'd love to know in the chat what organization you represent and where you live in Nevada. I'm located in Iowa, and so I like to know, gives me a good idea of the geography, and I get jealous of your weather, especially of those of you in Vegas today, where it sounds like it's 80 degrees, which sounds lovely. I'm here with my blanket and space heater in Iowa. So thank you so much for joining us today. We're super excited to have you. This is being recorded. Just a couple of housekeeping before we get started. Like I said, it's being recorded. After the webinar, I will go ahead and send out an email with a PDF of the slides, the recording, and then some links that we talk about throughout the presentation today. Go ahead and put questions in the chat or the Q&A function as we go. I do that so I can look at them at the end, and then I'll answer any questions you have. But then maybe sometimes your question gets answered. So I like to do that towards the end. I'm going to also take my video off for the majority of the presentation, only because I have a couple videos to play, and I think that can be distracting with videos playing. So with that, I'm going to go ahead and do that and get started. So like I said, my name is Megan Ockett. I'm super excited to be here today talking to you all. And I have to do a shout out for the Health Plan of Nevada. It's because of our partnership with the Health Plan of Nevada that we are here in the great state of Nevada sharing this wonderful information with you all. It's why you can access the materials for free and get this type of training. So I'm super excited to be partnered with Health Plan of Nevada. And so here is my contact information. Feel free to jot it down, or like I said, you'll be getting an email from me shortly. But I really like you to contact me with any questions you have after the presentation, throughout the year, any ideas, because I will say this multiple times through this presentation, but you are the boots on the ground. I am just the messenger sharing this information, sharing this education, but you are truly the one making the impact, talking to your expectant parents, talking to your community members. And so I want to make sure what we're doing works for you. So if we need to do something else, if we need to create something, if we need a different language, you let me know, and we will work together with Health Plan of Nevada to make sure that can happen. So feel free to take down my contact information. A little bit about me. I've been with the organization for about 3 years, and my background is in public health, specifically around prevention and education. After having my own kids, I have 3 kiddos, 9, 6, and 3, and I just fell in love with maternal and child health. And so really fortunate to be working and doing what I do and working to educate and empower you all, to empower the expectant parents you serve, just makes my day. And so my background, while it is in public health, I'm very, very passionate about systems change. So how can today take what you learn and integrate it into your workflow? What can you do to make sure that this is easy, this is second nature, whatever we need to do, however I can help, that's what I'm here to do today. So I hope that you walk away knowing more about the campaign. If you didn't know anything about it, hopefully you learn all about it. If you already know about Count the Kicks, I hope today you learn something new. And I hope you just sit back and relax and enjoy the presentation and get excited to talk about this with your patients and to save babies in the great state. So with that, I always like to start out with a video, and I start out with this video for a couple of reasons. One, it's a feel-good video. And so I know we're kind of getting into that afternoon slump. So I want to just wake you up while you're eating your lunch or drinking more coffee or whatever it is, and just put a smile on your face. This story is about baby Ruby, who was saved when her mom noticed reduced fetal movement using the Count the Kicks app, and spoke up to her provider, and baby Ruby's here because of it. And so I like to share the story for that, but I also like to share it because it does a really good job of If you're not familiar with the campaign, it does a really good job of just giving you a quick overview of how it works and why it's so important. And then 3, I like to talk about it because I will reference it a couple times throughout the presentation today. So let's go ahead and watch Baby Ruby. I will say this is slightly delayed, but you should be able to hear it just perfectly.
We're going to turn now to that GMA parenting alert about a free app a mother says helped save her baby's life by tracking how often she kicked. ABC's Diane Macedo is here with that story. What is this all about?
So this mother says that everything was completely normal in her pregnancy until one day, thanks to this app, she noticed that something was off. Well, it turns out her baby was in real trouble.
For Emily and Jeremy Ecoff and 2-year-old Liam,
oh, nice.
life with their new baby Ruby is extra precious.
We have a healthy baby girl and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
It's just one of a growing number of apps helping parents through pregnancy and labor. For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
She sleeps about 23 hours a day.
4 weeks later, Ruby is now home, healthy, and sleeping like a baby.
Doesn't get much cuter than that. Now, the app was made in Iowa, which is where that family is from, but the creators say it's now spreading nationwide, thanks in part to Ruby. Since the news of her birth, the app has gained more than 5,000 new subscribers. So, Robin, the app saved Ruby, and by raising awareness, she may end up saving many more.
So one thing I should mention too is the power of storytelling. Like that reporter said at the end, the app has increased dramatically since that aired in 2017. And that's true. Our app users, that increased our app users by about 3,700%. So it was amazing. So I think anytime you have an opportunity to share one of these baby safe stories with expectant parents you work with, whether it's in a childbirth ed class or anything like that, please do so. They're on our YouTube channel. They're on our website. Some are even in our app itself. And I think that's just a good way to share the message and share the story. And that's what people are going to remember. You're going to remember today, baby Ruby, and you're probably going to remember the last story I'm going to share with you too about baby Nala. But before we get to Nala, let's just level set and make sure that we're all on the same page when it comes to terminology. And my guess is that you all are understanding of what stillbirth is and in relation to miscarriage and infant mortality. But just in case you need a refresher, today we're talking about stillbirth, which is the loss of a baby after 20 weeks of pregnancy. It's further classified as early, late, or term. And on average, we lose around 23,500 babies every year in the United States to stillbirth. Miscarriage is usually defined as loss of a baby before the 20th week of pregnancy. And then infant mortality, where I think a lot of people get confused between infant mortality and stillbirth or think it's the same thing. Infant mortality is actually death of an infant before his or her first birthday. So they are born and they take a breath and things like that. That's infant mortality if they die within that first year. On average, we lose around 22,000 infants every year in the United States to infant mortality. And so what I want you to take away from this slide is the fact that we lose just as many babies to infant mortality as we do to stillbirth. In fact, we lose slightly higher babies to stillbirth than to infant mortality. And that's not to underscore the tragedy of infant mortality or anything like that. What I want you to know is that we need to be talking about stillbirth, just as much as we're talking about infant mortality and prevention methods, just as much as we're talking about the importance of the back to sleep and that back to sleep campaign. Kit counting should be just as common as that practice. And so until we feel comfortable talking about stillbirth and mentioning it and saying the word and talking about prevention, that's when we're going to see that number go down. And that's what I want you to do today. I want you to leave comfortable knowing that you can and should be talking about stillbirth and stillbirth prevention. And that's how we're going to save more babies. So if we look at stillbirth by the numbers, it's a lot more common than people think. 1 in 169 pregnancies across the United States will end in stillbirth. And unfortunately, the racial disparities are large. For Black women, it's 1 in 96. Black women are 2 times, sometimes 3 times, depending on the state, more likely to experience a stillbirth over white women. Hispanic Latinx moms, it's 1 in 199. Indigenous moms, 1 in 138. White women, 1 in 204, Asian Pacific Islanders, 1 in 233. Again, just as prevalent as infant mortality. Families are 10 times more likely to lose a baby to stillbirth than to SIDS. If we break that number down, that 23,500 even further, that's 65 babies a day. And I can guarantee you, if that was a kindergartner class or a busload of 65 kids that died, that would be all over the news. So that's putting it in perspective, right? That's 65 babies a day. If we bring it closer to home for you all in Nevada, your stillbirth numbers. So based on the most recent 5-year average, the stillbirth rate in Nevada is 6.8 per 1,000 live births. So you can see that chart there. You're the red line, the United States is the teal, and then Iowa is the yellow. So you tend to be slightly higher than the national average for stillbirths. On average, you're losing around 245 babies a year due to stillbirth. And with this campaign, what we've seen in Iowa, which I'll talk about here in a minute, is the fact that we're saving 1 in 3 at-risk babies from preventable stillbirth. And so if we take that and combine that with the number of that you're losing, we have the potential to save 78 babies in Nevada on average with this campaign. This is what we want to see happen in Nevada. What you see on your graph or on your webinar right now on your slide is what we've seen and what we've done in Iowa. So in 2008, when the campaign began, you can see on this chart in particular, Iowa was at one of the highest stillbirth rates on record. You can see what I really want you to pay attention to is that dashed or dotted line, because that's the trend. And so what you see here is a 32% reduction, that trend line, between 2008 and 2018. And then again, we continue to maintain almost that 32% reduction in 2021. And so when we talk about 1 in 3 and a 32% reduction, we're talking about the data that we've seen in Iowa. Since the inception of the campaign in 2008, we've seen a 32% reduction in the number of stillbirths here. We've also seen about a 39% reduction among the number of stillbirths among African-American women. And so we want to bring and replicate this campaign to other states to save more babies. And that's exactly what we're doing with the Health Plan of Nevada, partnering with them, collaborating with you all on this call today to share this information so you can help us get to this 32% decrease or more. That's what we would love to see. And so I always like to show this graph. It comes from Iowa Department of Public Health, but also what's important to know is that Iowa Department of Public Health and officials have said there really wasn't anything else going on in Iowa that would have made such a dramatic decrease, which there was nothing else going on that would have made such a dramatic change in the stillbirth rate. In fact, risk factors like obesity and smoking have increased here. So public health officials have stated that this was really the only thing happening in Iowa that made this impact. You can see there's a couple outliers there, like 2017, things like a syphilis outbreak or a pandemic can impact the stillbirth rate year to year. So that's why we're really paying attention to that dash line to make sure that we're continuing that decrease. So you might be thinking, why are there such large disparities? Why are Black women 2 times or 3 times more likely to experience a stillbirth over white women? And I think it's really important to take a moment and share what researchers are saying are these contributing factors to this and how unacceptable it is. So things like systemic racism, toxic stress, research shows that years of being treated unequally and unfairly, essentially being an African-American woman in a systemically unjust society, and everything that comes with it, has led to real and pervasive health issues for Black women. Epigenetics, those physiological variations, predisposition to certain conditions that may lead to stillbirth, like gestational diabetes, high blood pressure, which are all linked to maternal stress. Experts say Black women are less likely than other races to receive early treatment for these conditions, access to healthcare, socioeconomic barriers. But it's important to note, research shows education is not a determining factor. A college-educated Black woman is still more likely to lose her baby than a high school-educated white woman. So we know there's large gaps among racial disparities in stillbirth, and we have made it a priority to focus on this. We have done a variety of different things to shine a light on this issue and hopefully decrease the number of stillbirths among these individuals. And I hope that you can take what you learned today and start thinking about what you can do in your own workflow to get to a point where race is no longer a predictor of stillbirth. So we have a health equity coordinator on staff. We have an individual and individuals who continually look at all of our materials, look at all of our resources to make sure they're inclusive. We're always looking for funding opportunities to reduce racial disparities that persist and exist in stillbirth. We're an inclusive organization with 100% board and staff trained on anti-oppression and structural racism. We have looked and worked to improve programming based on the lived experiences of women of color. We're working within marginalized communities. We're working outside typical healthcare settings. We have done focus groups and community conversations and learned how people get their health information. And a lot of times it might be not a healthcare provider, it might be their minister, or their pastor, or their friend, or their grandma. So we created a faith-based toolkit and a salon toolkit to train clergy and the like about Count the Kicks so they can share it during the announcement section, so they can share it during Bible studies. We also have an app in 14 languages. We have culturally appropriate educational material. We have videos and printed educational materials and FAQs in multiple languages. So like I said, if there are things that are missing as we go through today and you're like, oh, I really wish it was in this language or you had this, please let me know. And we will do everything in our power to make sure that we do that, because we want to be as inclusive as possible. All right, so we know about the data. We know a little bit about the numbers behind stillbirth, but what about the research? This is an evidence-based campaign. And so I want to take a couple moments before we dive into the implementation and truly what Count the Kicks is, to build it up to show exactly how this is an evidence-based research-backed campaign. And if you are really into research and you love reading journal articles, hats off to you. Go to our website. We have an evidence page dedicated to research articles talking about why this is so important and impactful. But if you're not that into research and you don't spend all your time reading journal articles, I highly recommend you do read one. And this is the one I want you to read. This on your screen is the research study that started it all. And what I mean by that is the fact that we were founded by 5 Central Iowa women who all experienced stillbirth or infant loss in the early 2000s. And they did not know each other at the time of their loss. They got connected through pastors and friends and connections. And as they were grieving together and talking and thinking, here we all sit, 5 women who had relatively perfect pregnancies. They didn't know each other, but around the same time period, they all experienced the same thing, a loss. And they said, this is a lot more common than people think, and we need to do something about it. So fast forward to a public health conference that some of them attended. And at this conference, they heard these researchers, Dr. Ruth Fretz here being one of them, talk about a study that they had done that in Norway, this public health study in Norway showed when expectant parents were educated on getting to know what's normal for their baby, that the stillbirth rate among this cohort of women that were educated on this decreased about 30%, just by educating, just by handing a pamphlet about the importance of tracking fetal movement, starting in the 3rd trimester. So some of the founders heard this and they said, that's amazing and so simple and so non-invasive. Let's do that. Let's bring this back to Iowa and the United States. Let's create this. Kit counting's been around forever, but the tools and resources to be able to talk about, to be able to share and empower expectant parents wasn't created. And that's exactly what they did. They worked with other researchers, and they worked with Iowa Department of Public Health to create what we know now as that bright, colorful Count the Kicks campaign. And so this quote here from Dr. Ruth Fretz says, tracking fetal movement is a non-invasive way for expectant parents to monitor their baby's health in the third trimester of pregnancy. Babies can be saved when expectant parents are educated on getting to know their baby's normal movement pattern starting at 28 weeks and to speak up if they notice a change. So you're going to hear me reference normal movement pattern a lot, and I'll get to why I do that quite a bit throughout the presentation. We also were named a best practice through the Association of Maternal Child Health Programs, or AMCHIP. They do a scientific review, and they look at several different things. They look how we engage stakeholders. They look at other research, how we include equity at the center of everything that we do, sustainability. And so you can read our whole best practice info sheet on the website as well. CDC Hear Her campaign, I'm sure you've all heard of this, but they also list babies' movement stopping or slowing down during pregnancy as a warning sign. And I think my number one question I get, or thought or comment, is the fact that, or people think the fact will be that when you educate people on this, that if you work in a clinic, you're going to get calls all the time. You're going to have nurses run around answering these questions. And really that doesn't happen. And research has shown that. So this quote here is really telling, where it says, one potential side effect of routine monitoring of fetal movement could be an increase in prenatal visits, either outpatient or in the hospital. However, most research has not found this type of increase to be true, and usually the fetal movement count is reassuring to pregnant women and prevents unnecessary visits. And the reason for that is because now you have a highly educated expectant person who knows what's normal for their baby, who feels confident, who feels comfortable knowing that, and then can easily speak up if they notice a change and they're not guessing or anything like that. We've also done our own study of our app users through the Des Moines University and the Harkin Institute, and found that 84% of our app users stated that regular tracking was associated with feelings of bonding, and 77% of app users reported feeling less anxious. They also stated that using a mobile health app to empower mothers to monitor their baby's fetal movement, that preliminary research shows the mobile health app increased awareness of a change in fetal movement and a reduction in stillbirth. And so we also just released a white paper, again, with the Harkin Institute, that's titled The Link Between Stillbirth and Maternal Mortality and Morbidity. I don't think people make the connection, but we know, and research shows, that if you have a stillbirth, you're about 4 times more likely to die as well. And so we wanted to highlight that and share firsthand accounts from American women. And so if you scan this QR code, it takes you to our evidence page, which I know some of you are going to love, and you're going to read all the evidence there. But if you don't, our white paper is there. It's a really easy read. I highly recommend doing that. The purpose was truly to highlight that connection and how Count the Kicks can help improve health outcomes for expectant parents and babies. And so I think this is a really important piece to know and share with your team, because not only are we potentially saving babies, but we're also potentially saving moms as well. Speaking of added benefits, I think it's also important to note that maternal fetal movement monitoring has benefits like reduction of preterm birth rate. It's not like every time somebody comes in with reduced fetal movement, they automatically have an emergency C-section or automatically have to get delivered. It can indicate there's another issue that people can help with, that the providers can help with, and make sure baby does get here safely at 40 weeks. So there has been a reduction in preterm birth rate. Those fetal growth restrictions might be identified earlier. And then again, we know that women who have stillbirths are at substantially higher risk of severe maternal morbidity than women who have live births, regardless of the cause of fetal death. So this quote here says, due to the low cost and potential benefit, it is recommended. Decreased fetal movement can indicate a need for more evaluation and has the potential to save lives. And that's exactly the point. It can indicate a need for more evaluation. Like I said, it's not like they just run in and get a baby right away, right? There's a protocol, there's a check and balance that you need to go through as a clinician of, do you do the biophysical and the NST? And then, you have that protocol in place at your clinic. Okay, you know about the research, you know about the data, you know all of that. So let's get into the meat of this. So this is it. This is the method for paying attention to babies' movements. It's highly effective. It's super simple and easy way to teach expectant parents. This is just a cute little sheet that we put together. So starting at the 3rd trimester, you want parents to begin counting. You're going to share tracking their baby's movements with our free app, which I'm going to talk about here in a minute. Or we have paper charts that they can download or you can download on our website. We want people to count every day, preferably around the same time. And you're going to time how long it takes baby to get to 10 movements. You're going to use the app, especially will help with that. And I'll share that in a minute. And then after a few days, you'll really begin to see a pattern. The expectant parent will begin to see a pattern. And that's just normal baby fetal movement routine that around the 3rd trimester, they get into that pattern. So that's why after a few sessions, they'll be able to see that pattern and to speak up if that changes. And then we want them to continue tracking every day and calling their provider right away if they notice a change in the strength or how long it takes baby to get to 10 movements. This should take 3 to 5 minutes of talking to your patient about at every single appointment in the 3rd trimester. So now one of my favorite parts of the presentation, not my only, but one, is I get to be the only presenter ever that you will see and hear that will say, I want you to take out your cell phones and I want you to multitask, because I know we can all multitask because we live in the United States and we're busy, busy humans. So I want you to take out your phone and I want you to go into your app store and I want you to download the Count the Kicks app. So just search, whether you're in the Google Play Store or the iPhone store, just search Count the Kicks. You're going to see the yellow clock icon and I want you to download it. And I want you to download it because I want you to use it. I want you to have as many pregnancies as you want in that app. And I want you to see how user-friendly it is so that if you're working, if you're a home visitor and you see clients or you're a nurse and you have a patient come in, you could potentially pull out your phone and say, look how easy this is. You are in your 3rd trimester. Let's make sure you get set up and registered so you can start counting today. It's available in 14 languages. You can see those on the screen. Again, if you have a language you don't see, let me know if you need it. If you work with a population that you're like, they really need to get this language. We work with a lot of different demographics and things like that. Please let me know. It's completely free. There are no ads. The only pop-up you get, which really isn't even a pop-up, it's just a fact. It's like a daily message in the app after a kick session. That's all there is. There's nothing else. And it's something we control. So it's all about the importance of counting movement, the education around that. So how it works is when you go to set up and you register your account and your pregnancy, you put in your due date and everything like that. All you want to do is when you're ready to pick that time of day, let's say it's 2 o'clock in the afternoon, that's when, you know, baby's most active for you, or that's when you feel like baby's most active. And so you're ready to count, you sit down, you put your feet up, whatever, get comfortable, you hit that big red button that says start counting. And then you're going to see that screen there with the footprint. And as soon as you feel baby move where you want to start with that session, you tap the footprint and a timer is going to start automatically. Every time you feel a baby move after that, you tap that footprint until you get to 10. So rolls and jabs and pushes, you're tapping that footprint. As soon as you get to 10, the timer stops. And then what you see is a graph. So that image behind that footprint there is after a couple sessions, you're going to be able to see very visually how baby's been moving, what baby's normal is. And so in this example, on this image, it looks like it took baby 15 minutes and 6 seconds during that session at 2 o'clock. And in the last couple sessions, it took around 15, 16, 17 minutes. So my average time is around 15 minutes and 24 seconds. So you can see it's very linear. It's a very visual graph, very easy to see. If one day I'm counting and all of a sudden it took, you know, I don't know, 45, 50, 55 minutes, that graph's going to change visually and it's going to shoot up and increase. And so that's going to indicate to mom to say, that's not my baby's normal, right? My baby's normal around this time is around 15 minutes, 16 minutes. So I'm just going to call my provider and see what they want me to do. I'm going to contact them and work with my clinical care team to see what they want me to do. And that's it. That's how simple it is. Some other features that I really like and want to share is that you can restart a session or delete a kick. Maybe you accidentally tap the footprint and it was a hiccup, and that doesn't count because it's involuntary. So you can delete that kick. I highly, highly recommend that if you are working with patients and clients, you make sure they get set up on the daily reminders so they can do that within the app. So they don't have to go out to their own calendar and set up a daily reminder. It is really imperative that people are doing this daily, preferably around the same time. Otherwise, you're not going to get that good sense of what your baby's normal is. So setting those daily reminders up in the app, and then you get these fun little push notifications of things like, hey, time to count your little kicker, or something like that. Another really important feature is to review kick counting history. You can, as a user, download your entire history, and then you can share it with your provider. You can share it with your significant others. You can share it with family or on social media if you want. But in a time of a pandemic or endemic or whatever we're in now, where telehealth appointments are popular, could you download that and share it to like a My Chart or something like that? Absolutely. So it also indicates to provider, maybe they don't know about this and they can say, oh, my patient's using this. What is this? It's just such a great tool for both provider and patient to know about. You can count for single babies or twins. You can track future pregnancies on the same profile, and you can manage multiple devices. So I could be counting on my phone. My significant other could have it on his phone, so he could just at least see it. He can be part of it. He could feel included. It goes also to that bonding. I could be counting on my watch, which is a brand new feature on my Apple smartwatch, and it could sync to my phone. So just a lot of different uses for it. Another thing that I really wanted to know and share was we recently added a strength tracking and notes feature. And we did this because what research now indicates is not only should we be paying attention to how long it takes baby to get to 10 movements, but the strength of those movements as well. And so, like I said on this slide, what you're doing is you're tapping that footprint every time baby moves. And then when you get to 10, it stops. And so what you're going to do after you get to 10 movements and the timer stops, you're going to see a screen like that second image there that says, almost done. Please fill out the following fields to finalize your kick session. And then basically the user has 5 empty feet and they can tap, color in 1 through 5, meaning 1, the movements were very soft, delicate, fluttery, all the way up to 4 and 5, which would be fierce. Those movements you might see from the outside, you feel like limbs are poking out, whatever it is, that's what the person can fill out. And so if you think back to baby Ruby's video, when her mom said her movements just felt weaker, they felt softer. That's what they're checking here. After that session, after we get done tracking how long, we're going to track how baby felt, what those movements were like. And so after you fill that chart out, you will get that graph. It's a bar graph for strength. You also get the average movement strength. So it's, again, very visual. So that final screen there that you see, that final image, that's an example. Let's say I'm counting. You can see the top graph is my movement. It's very linear. And then all of a sudden it shot up. That must have meant that my baby took significantly longer. And then the movement strength also decreased. I'm not saying that these have to correlate. What I'm saying is that, and I'm showing, is how visual the graphs are, so you can easily see. So yes, if the strength decreases, that is a sign we might want to, we want you to get checked out. You could have the same type of movement time, but your strength decreased dramatically. Get checked out. So I think it's just really important to reference that with your moms and your patients, just to let them know, like, if anything changes, if there is a significant change, to contact their provider, no matter what time or day it is. And if they can't get a hold of somebody, go into the hospital, because hours and minutes matter when it comes to this. We also have videos on our app, just not all of them, but several of them, like how-to videos, elevating women of color videos, equity videos, baby saves, why we count. So feel free, if you're working with expectant parents, to say, hey, watch this video, and then let's talk about it. Let's talk about how to track your baby's movement. So just another feature that you can access in the menu bar. And then we're super excited about this feature as well. This is in the resources section of the menu bar. You can see there on the image on the right-hand side, there's resources. And people can go to this website to put in their zip code and find free or reduced cost services. And so we launched this in January of this year. People can enter their zip code, and maybe they need help with housing. Maybe they need childcare assistance. All they do is find the programs in their area via their zip code. So this is an example of my area. I have about 2,000 programs, and then I can filter further down. Maybe I need housing assistance or something like that. We have had a huge increase of people using this, which is great. I mean, we want to connect people prenatally to resources and services they need, because we know if we can connect that, if we can reduce stress prenatally and get people what they need before baby, the chances of their baby experiencing adverse childhood experiences in that first year decrease significantly. So we want to make sure we connect people to all the resources that we can. And then here is just a short video of how to use the app that I wanted to share with you. Again, this is on our app, so you can share it, but this is just a short, sweet video, very simple. You can even have it in a rotating, if you're in a clinic setting, could you have it rotating with like subtitles or something like that? So let's watch.
The Count the Kicks app, a cutting-edge, powerful tool for expectant parents in the 3rd trimester of pregnancy, has a new feature to help you monitor your baby's movements. The new strength feature allows you to rank the strength of your baby's movements on a scale of 1 to 5, from fluttery to fierce. Research shows paying attention to the strength of your baby's movements is vital. If a baby's movements becomes weaker, studies show this could be a sign of potential problems, and expectant parents should alert their doctor. The free Count the Kicks app now gives you the option to take notes on your session. Our app is available in 12 languages in the Apple and Google Play app stores. It is a simple and non-invasive way to monitor your baby's well-being every day in the 3rd trimester. Features include kick counting history, daily reminders to count, and the ability to count for single babies and twins. Simply tap the footprint every time you feel a kick, roll, or a jab, and the app will time how long it takes your baby to get to 10 movements. Log in to save your kick counting data and get to know what's normal for your baby. Be sure to speak up and tell your doctor if you notice a change in the strength of your baby's movements or how long it takes your baby to get to 10 movements. Hospitals are open 24/7 and are ready to listen to your concerns. Join the community of expectant parents who are in tune with their body and their baby by counting kicks daily in the 3rd trimester. You can also find it on Apple Watch. Download Count the Kicks and start counting today.
So yeah, super simple, easy video. She says 12 languages for the app, but we added two languages after we shot that video. So it is 14 languages. Okay, so we know about the app. You downloaded it, you're multitasking, you're playing around with it. Let's take a moment to talk through, when do you start talking about this and how do you do it and how do you integrate it? Remember, as I talk through this next session, I really want you to think through your own place of work and how you work with expectant parents and how you could integrate this into your workflow. So you want to be talking about this at 26 weeks if the person is high risk, 28 weeks right at the beginning of that 3rd trimester otherwise. You want to use open-ended questions. How would you describe your baby's normal movement pattern? Let's talk about how to track your baby's movements and sharing how movements are jabs, rolls, pushes. Again, hiccups are involuntary, so they don't count. And stressing that, you know, as an expectant parent, you're learning your baby's normal movement time. So you can speak up to me as a provider if something changes, or if you're talking to somebody and you're not their provider, indicate that they can call their provider anytime. Do they know the number to call if it's after hours, etc. And really sharing that the Count the Kicks app helps bond with baby, right? You can include significant others, you can include siblings saying, it's time to count baby's movements, come on, you know, and have your 3-year-old come over and feel mommy's tummy and things like that. If you are listening today and you work in a clinical office, and I don't know how it works there, but in Iowa, a lot of times we have to take our glucose test in the office, and then we sit there for an hour, and then we go back to our appointment for like the 10-15 minute appointment. So if that happens, that's a perfect opportunity for you to say, okay, take this awesome drink we all love, and then here's a brochure on Count the Kicks. download the app after you're done reading it, and we'll talk about it here as when you come back for your blood draw and your 10-minute appointment and things like that. So again, super simple way to include this. I think that it's also important to recognize and understand that we know, and I'm sure you know this, that talking about stillbirth is something that nobody wants to do. It's devastating, it's tragic, it's terrible, but it's so important that we talk about it. And again, those numbers are not going to change until we start recognizing it and talking about it, and talking about the methods that we can use that are evidence-based to help prevent preventable stillbirth. So even if you're thinking you don't want to scare moms, you don't want to scare expectant parents, please remember that pregnancy is full of risks that we talk to people about. We talk to people about the reasoning why we do certain blood tests, why we're doing certain ultrasounds, why you should take a prenatal vitamin, why you shouldn't drink. Stillbirth is another risk that moms deserve to be educated about. We are not delicate flowers. Talk to us about this. We would much rather know, and I think your patient would much rather know all of this and know there might be a way to prevent it than the opposite. Stillbirth just happens. There's nothing we can do. There can be warning signs if people know what to look for. Expectant parents know what to look for. Reduced fetal movement, a change in fetal movement, is one of the earliest and sometimes only warning sign that baby's in distress. Here's a big one. Her baby's always active. It's not a concern. I'll say this a couple more times throughout the rest of the presentation, but the reason I recognize this so much is because I guarantee you, you will get this comment or feedback every single time you talk to somebody about this. Probably you will, if you do childbirth ed classes, they're going to say, half the classes and say, oh, it's a jungle gym in there, I don't need to do it. They're always moving. And I have the same response every single time. And I say, that's amazing and wonderful. And a healthy baby is an active baby, but it's still so important to track your baby's movements so that you can really know if something changes, and it takes the guesswork out of knowing that. And then she's almost at her due date. I think you all know this, or hopefully you know this, the risk of stillbirth increases actually as a mom approaches or exceeds her due date. What about talking to people who have experienced a stillbirth before? You would follow the exact same protocol, but you're going to start talking about it earlier. Remember, they're now high risk because they've had a stillbirth. So let's start talking about the importance of tracking baby's movement at 26 weeks versus 28 weeks. Feel free to talk about the previous stillbirth if you were her clinician or you weren't her clinician, or you just found out about it, asking the name and the gender, and staying away from medical terms like fetal demise, and then just simply asking, has anybody ever talked to you about this before? We work with a lot of lost moms, unfortunately, who have said, I've had perfectly healthy pregnancies, and my third baby, I had no idea. I noticed reduced fetal movement. I noticed a change, but I had no idea that that was a concern or something I should alert my doctor to. And why didn't I know? Why didn't I know this was so important? And so we today want to change that why didn't I know to I'm so glad they took 5 minutes out of their time during my appointment to talk to me about this. Some other common myths that you might be thinking or you might get throughout the time of doing this is only those experiencing high-risk pregnancy should pay attention to their baby's movements. No, we want everybody, all expectant women should be educated on this. It's just like we don't do the glucose test for only high-risk women. We do it for everybody. Same with this. 10 and 2 or 10 and 1, 10 kicks in 2 hours, common one I hear a lot. This goes back to that normal movement pattern and understanding what's normal for your baby, because every baby's different. And actually the recommendation to expect 10 kicks in 2 hours is outdated. Current research, which is also on the evidence page, indicates moms should work to understand the normal amount of time it takes to get their baby to 10 movements. And I'll tell you why I'll summarize the research as best I can. But basically what it says is, as human beings, we focus so much on the time, right? Like, you have an hour for this presentation. You're looking at that clock, you have an hour, you have 60 minutes. So when we get told 10 and 2 or 10 and 1, call me back if you don't get 10 movements in an hour, whatever you're telling patients or clients or things, that's what we focus on. Instead, we need to be focusing on what's normal for babies. So if I'm counting regularly and daily and know my baby's normal is 15 or 20 minutes, and one day I count and it's an hour and 47 minutes, I can't sit there and think, well, I still got it within 2 hours, so my baby's fine. Because in all actuality, I normally get it in 15 or 20 minutes. So you can see the difference there with the how that might be confusing for people. So it's really important to understand what's normal for their baby. I know there's Doppler devices, there's apps, especially with the pandemic and its heightened time when, you know, people were nervous to go in, and that telehealth appointments were all over the place. Prenatal appointments got stretched out. I think it's really, really important to stress that a change of the baby's heartbeat is one of the last things to occur when a baby's in distress. Whereas decreased fetal movement, a change in fetal movement, is one of the first and sometimes only warning signs. It's just like if you go into the clinic with reduced fetal movement or change in fetal movement, they don't just listen to you on the Doppler. They should be following a certain protocol. They're probably doing an NST. They're probably doing a biophysical, things like that. If baby's not moving, I should drink juice or eat something sugary to get baby to moving. Again, research has moved away from this idea that we should be having interventions like that to get baby to move. We know that kick counts are best monitored without interventions like juice and candy. If baby's not moving like normal, parents should speak up to their provider right away. Why are we trying to force baby to move? If something's not right, whether it's an umbilical cord or infection or whatever it is, let's not force baby to move. Let's get baby checked out instead. It's just like you and I, when we're sick, we don't drink or chug a Mountain Dew or eat a Snickers bar in hopes we get our energy up. We want to lay around. We don't want to do anything. We want to sleep. Same with baby in utero. If baby's not feeling good, whatever the reason, their movement is going to change and they should be checked out. Babies kick less than near the end of pregnancy. The types of movements may change, but you should still be getting the same movements in the same amount of time as well. You know, there might be more of those jabs versus those huge rolls where it feels like they're flipping type of thing. If you work in triage on this call today, or you know people that work in triage or labor and delivery floors, that is the perfect place to have this information. I went to triage 3 times with my daughter. She took about 30 minutes to get to 10 movements. My other 2 pregnancies took about 5 minutes to get to 10 movements. Yet another reason we do not compare pregnancy to pregnancy or baby to baby. But I did not know that was her normal was 30 minutes to get to 10 movements of when I chose to track and when I thought she was most active. And so that would be the perfect opportunity to have like an after visit summary form, to have a brochure, to have a poster up. So be sure to share this in your community, especially if you're driving around, if you go to coalition meetings, perfect time to have this information. So again, stress the importance of knowing their baby's normal and speaking up if there's a change. It's all about empowerment. Make sure the patient or client who you work with knows who to call. There's always those after hours. They should always be talking to a live nurse. They could go to their ER if they don't get a hold of anyone. I'm pretty sure as practice, if you go to the emergency room, if you're pregnant, if it's a pregnancy issue, you should get sent up to labor and delivery. That's how it is in Iowa. I'm hoping that's how it is in other places, but just to alleviate the concern of some expectant parents where they don't want to sit there for hours in the ER, they should technically get sent up to labor and delivery. We'll talk about the free materials here in a minute, sharing how research shows evening is usually the best time to count babies' movements. I wouldn't get too hung up on that. I know people work different shifts. I think the most important thing is to do it around the same time every day. And then again, using questions and statements like, tell me about your baby's movements. How is it going? Show me your graph. Ask them those questions. Other ways to integrate this. Do you work in a clinic where you can have a form at check-in to say, they check in, they're in their 3rd trimester. You want to talk about this at every single appointment in the 3rd trimester. Can they fill out a form with questions? What questions do they have? Having the front desk staff trained and the people who are making appointments so they can hand out a brochure. If you work with the home visitor, if you're a home visitor or nurse family partnership or anything like that, could you include this in the family care intake form? Again, the glucose test. And then my favorite would be the EMR, EHR records, because how easy is it to just add a couple lines about the importance of tracking fetal movement, or have a pop-up on the chart that says, oh, mom's 32 weeks pregnant. Did you ask her about fetal movement monitoring, yes or no, or, you know, that type of thing. This is an example from a hospital system here in Iowa that integrated Count the Kicks into their after visit summary. I'm happy to send this to you. They had no problems adding this to every single after visit summary form. So anytime anybody comes in and they get sent home, like I did with my daughter, this is a printout. They also link our printable charts, our kick counting charts on here as well. So I'm happy to talk to you about this. Another example is this community-based organization out of Ohio who wanted to do something, but they only saw expectant parents once throughout the year for this certain initiative. And they said, okay, we only see them once. We have limited time with them. They do have to fill out this form to get X, Y, and Z. How could we integrate this? So we helped them with some of the language and got that on the form. So again, easy, simple things that you can do. I'm happy to talk to you more about it if you want to reach out to me. So now my second favorite time, because you get to multitask again, and actually you get to do it in a fun way. Thanks to the Health Plan of Nevada, you can order all the materials for free, all of our print materials. We have posters, we have how-to posters like you've seen, we have app reminder cards, we have brochures completely free. So now what I like to do is give you like 2 minutes, because it really shouldn't take long. You just click on the link or type it in. I know we're multitaskers. You can scan the QR code, and I want you to order the materials. And if you order them during the session today, you will be entered to win a $25 gift card to Amazon. So you get to go shopping for great materials, and you might win something to go shopping for yourself. So I get to play this fun little song. Come back to me. Don't like close out or anything. Come back in just a couple minutes, and I am going to continue on with the presentation. We're almost done, but I want to take a couple minutes for you to order materials, because I feel like this is the best time to do it. You're paying attention, you're listening, you're focused. Let's just get it done and order the materials. So here we go. I'm going to play this and give you a couple minutes. And really grab a drink.
It might seem crazy what I'm about to say. Sunshine, she's here, you can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Bring me down, can't none bring me down. Your love is too high. Bring me down, can't none bring me down. I said, bring me down, can't none bring me down. Your love is too high. Bring me down, can't none bring me down. I said,
Okay, hopefully I gave you enough time. If not, keep going, because I get a report of everybody that orders, and then I get all these emails. It's really a fun time for all. So thank you for doing that. Thank you to the Health Plan of Nevada for offering those materials for free. Some other quick resources that we have: if you are a childbirth educator or you work with childbirth educators, we have sample lesson plans on our website too, completely free, that you can use. That's a great time to be talking about Count the Kicks. We also have some additional digital tools available for providers, those that work, all of you actually that work with expectant parents. We have a suite of educational materials guides. That's where you'll find the paper kick counting charts, tips on how to talk about it. And then you can send your patients, your clients, to our Count the Kicks Academy for Parents, which has additional videos, guides, and resources to help get baby here safely. And then we also have ambassadors. So Count the Kicks ambassadors are volunteers throughout the United States. We have one in almost every state. Some states have more than one. So these are highly invested, trained volunteers. A lot of them are lost moms, and their passion is just making sure nobody goes through the pain of losing a baby. And so your Nevada ambassador is Julia Taylor. She works in honor of her daughter, Sydney, and she can do things like attend baby showers, do webinars like this, just simple things like that. And so this is her with her other two daughters at a baby shower not too long ago. And then again, awesome, shout out to the Health Plan of Nevada, because you can take a CE training, which is very similar to what we took today, only it's a little over, it's about 2 hours, because we just increased it. We just added a whole equity and inclusion session. So it's actually, I need to update this. It's actually 2.2 CEs, which is super exciting. And you can take it for free. And so don't worry about like scribbling this website down. I will send it in the follow-up email. But during registration, if you use the code SAVEBABIES-NV, you can access this training for free. So I will make sure to send that in the follow-up email. And then, so we talked about that. And then finally, the impact of our work, our beautiful, beautiful baby saves. We have about 100 on our website that we know about. We know there's hundreds more out there of people that found us, that you were using the app. They were told about Count the Kicks, and they noticed a change in babies' movements. They spoke up, and baby's here because of it. And so why do we do this? We do this because we want to save babies. And I know you want to save babies. So we do this together so we can save more babies just like Nala. So let's watch her story, and then we'll wrap up.
She came back in after she had me put on the monitor and stuff. And she's like, we're just going to take her. And I'm like, what? And she's like, her heart rate is dropping every time you have a contraction. I was already scared, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. When she started moving, I was very alert with her movements, That was what I lived for, just because I wanted her to, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm gonna get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, what if? Definitely to pay attention to count the kicks, I feel like it's important just because had I not, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, because your baby might not be here. You just pay attention, seriously, like it's your baby's life.
So Nala, baby Ruby, that's what you're going to remember today, and the fact that you got to hear a cool song and order materials. But you're also going to take all this information back. You're going to share it with your team members. You're going to order the materials, which you already did. You're going to take 3 to 5 minutes to talk to patients and clients about this every time you see them. You're going to make sure the entire staff knows about it. This is being recorded, so share it with them. You're going to figure out ways to integrate this. I'm going to work with you on it. Contact me. And then remember, hours and minutes matter. If you work in rural areas and you have an expectant parent that has a 45, 50-minute drive to a birthing center and it's 9 o'clock at night, she can't really wait for the clinic to open the next day. So she needs to go get checked out immediately. So educating on that too. So with that, contact with us, share our resources. We have all these social media outlets, sign up for our newsletter, contact me. I'm happy to hear from you. I'm happy to answer any questions. And I know because we work on timing, like I talked about, I got you right in at the hour. So I'm super pumped about that. And I will look and happy to answer any questions. I'll stay on for a couple moments, but you either have to use the Q&A or the chat box or raise your hand, and then I can unmute you because you're already muted. So thank you for taking the time out of your busy schedule today for your lunch break, for learning about this and being with me for an hour. I truly love what I do. And I love that you took time out of your day to learn about it and to implement it into your community, because that's how we're going to save babies. So thank you. And I'm just going to make sure I didn't say anything. Let's see. I'm just answering questions. Would love to have a flyer to add to the folder for hospital tours. Can we connect? Yes, Kathy, let's connect. Hi, Adela with Dignity Health. Do you know someone that no longer qualifies for Medicaid? Call me. Okay, perfect. I already ordered prior to the meeting. That's okay, Candace. I'll make sure that you're included in the drawing. Just finished kit counts myself and ordered some brochures. Oh, are you pregnant? Awesome. Thank you. Oh, you guys are so nice. Thank you. I'll stay on for a couple more minutes, and if anybody wants to talk to me, obviously I like talking, so I am going to stop the recording.